Imagine being so passionate about playing a full contact sport that you play through the extreme pain of injury for years, even having to painfully self-drain your own swelling just to keep playing. Well, meet Joel Gonzalez. Joel Gonzalez is a 35-year-old Michigan resident who is so devoted to playing hockey, he brings a new meaning to playing through the pain. Thankfully, the DMC has a sports medicine program that addresses injuries suffered by the Detroit Red Wings, right down to weekend warriors like Joel Gonzalez. Dr. Gary Gilyard is one of the DMC sports medicine program's outstanding orthopedic surgeons, with a passion for the innovative procedures that help professional athletes and patients like Joel do what they love. He's not a professional hockey player. This is a weekend warrior.
No, he's about as close to professional as a weekend warrior can get.
It all comes to your knees. That's basically, I mean, your feet will slide, but your knees take all the brunt of all the hits.
One hit about 10 years ago started him on a path of repeated knee repair.
They went in and they were able to repair it with a scope.
10 years and 8 scopes later, and Joel was not only still in pain, but his knee was filling with fluids that he daily drained himself just to get back on the ice.
He had to have his knee drained 2 and 3 times a day.
Yeah, it was getting more painful.
Then Joel met Dr. Gilyard. He recommended that Joel have an OATS procedure, which stands for Osteochondral Autograft Transfer System.
If you looked at it, it would be just like a pothole in a road. And now every time his patella rides over that area, it falls down into that pothole and it causes him pain.
With this relatively new procedure, Dr. Gilyard takes cartilage plugs from areas of Joel's knee that are non-weight bearing and uses them to repair the damaged area of the kneecap.
This is the defect. This is normal cartilage right here. Yes. And right here. Yes. And this is the pothole right there.
Dr. Gilyard replaces damaged cartilage from the hockey injury.
I'm drilling along the bone, and it goes up into the joint.
Taking a core of cartilage and subchondral bone from an area of the knee that's not crucial to weight bearing, Dr. Gilyard uses that to repair or plug the damaged area. He then goes back and fills the non-weight bearing hole. Wow. Perfect fit, huh?
Yeah, perfect fit. That is the new graft in place. Now, instead of having a pothole there, he's got his own articular cartilage with it connected to his own subchondral bone, and it's going to distribute the weight. His tissue will form around the bone, grow into the bone, eventually become the bone. No more potholes, and he's going to do great.
A full recovery takes about 8 months. Joel has already channeled his enormous energy into rehabilitation. We visited with him in rehab 6 weeks after the procedure.
And I don't feel it in the knee at all. Fine. Want to throw a medicine ball or something at me? I felt great right after the surgery. No pain, and basically just progressing through therapy.
And 3 months following the procedure, Dr. Gilyard and especially Joel couldn't be happier. So you're happy with the outcome?
I'm very happy with the outcome.
And I think you're going to be a better hockey player because your knee will be more efficient.
Right. I'll actually be able to skate with 2 legs instead of 1 leg.
Great.
And that's the one thing that I love about orthopedics. You get to restore someone to that high level of activity, and they can go on and do what they like to do. It's very gratifying.
If you'd like more information on this surgery, or if you'd like to make an appointment with Dr. Gary Gilyard or one of the DMC sports medicine specialists within the program, like the Detroit Red Wings do, you can find the information you need at dmc.org or at 1-888-DMC-2500. I'm Emery King.